Hello, my name is Shada Pedram, and today I will be presenting on toxoplasmosis. Toxoplasmosis is caused by a parasite and happens to be one of the leading causes of death attributed to foodborne illness in the United States. The U.S. sees over 200,000 cases per year, making it relatively common. Parasitic infections are commonly associated with poorer communities and lower income countries. However, toxoplasmosis is considered one of 5 neglected parasitic infections in the U.S., according to the CDC. NPIs are targeted for public health action due to lack of surveillance, prevention, and treatment in relation to how many people can contract it and how preventable it can be. There are many different modes of transmission of toxoplasmosis. Consuming undercooked contaminated meat would be one. Eating food that was contaminated by utensils, surfaces, or other foods that had contact with raw contaminated meat would be another. Drinking contaminated water or swallowing the parasite through contact with cat feces, whether it was due to changing a cat's litter box when it had shed the parasite in its feces, or ingesting anything that had come into contact with the cat feces that contained the parasite. So, an example of this would be if you have a garden that isn't fenced and stray cats can just come and go, and if there's cat feces in your garden from a cat who was infected with the parasite, your fruits and vegetables could be contaminated. Mother to child transmission is another form, as well as receiving infected organ transplant. However, that is very rare. So, most people who become infected are actually unaware because they do not end up presenting with any symptoms. Some individuals will feel like they have flu like symptoms that may last a month or more. Severe toxoplasmosis is defined as damage to brain, eyes, or other organs and can develop from acute infection or reactivated infection. However, it is more likely to occur in immunocompromised individuals. Ocular toxoplasmosis is when the parasite is actually in the eye. So, signs and symptoms of this would include reduced or blurred vision, pain, and redness of the eye. A diagnosis of toxoplasmosis can be made with a blood test to check for the antibodies to the parasite. If the antibodies are present, then an infection is indeed present. High-risk groups include infants born to mothers who are infected with the parasite during or right before their pregnancy, or those who are immunocompromised, such as AIDS patients or those undergoing chemotherapy, just to name a couple. Prevention strategies include cooking food to safe temperatures. So this includes cooking meats between 145 to 165 degrees Fahrenheit in order to kill the parasite. Making sure that you peel or thoroughly wash any fruits and vegetables before consumption, avoiding eating any raw or undercooked oysters, as well as ensuring that you wash and sanitize any cutting boards, dishes, utensils, countertops, hands, anything that could possibly have been in contact with raw meat or unwashed fruits and vegetables. If you are a cat owner, making sure that you change your cat litter box daily is very important. And this specifically is because the parasite actually does not become infectious in cat feces until about 1 to 5 days after it's been shed. So if your cat has toxoplasmosis and you change the litter box daily, you're at very minimal risk even then of contracting the parasite. If you are pregnant or immunocompromised, it's heavily advised that you avoid changing cat litter if possible and avoid any stray cats or kittens. So, most healthy individuals recover without treatment. Pregnant women and infants can be treated, but the parasite will not be entirely gone. It will stay active in the tissue, but it won't be as active. Individuals with ocular toxoplasmosis are prescribed medicine to treat the active disease depending on the size of the lesion and the location. Immunocompromised individuals will need treatment as long as they are immunocompromised, so AIDS patients will need it for the rest of their lives. Specific drugs used to combat toxoplasmosis are pyrimethamine, known as Daraprim, and sulfadiazine, which is an antibiotic used in conjunction with pyrimethamine or Daraprim. In conclusion, toxoplasmosis is relatively common, easily preventable, potentially very damaging, and extremely neglected. Together, we can combat this potentially debilitating infection by spreading awareness and educating those around us on prevention. Thank you for your time.